What is trauma? Trauma is an experience of extreme distress that affects one's thoughts, feelings, physiological responses, and behaviors. Trauma is caused by a traumatic event that is experienced directly or indirectly. This event is typically characterized by abuse, neglect, abandonment, violence and aggression, grief and loss, and any event that is a threat to one's safety and security. The effects of trauma vary from person to person, depending on the individual's personality, temperament, and coping style. Common symptoms include anxiety and agitation, fear, worry, panic attacks, thought rumination, hypervigilance, flashbacks, nightmares and sleep disturbances, problems with concentration and memory, guilt, shame, depression, and avoidance. The effects of trauma can last for years and have a negative impact on interpersonal relationships. In interpersonal relationships, trauma can cause individuals to be mistrustful of others, guarded or distant, angry, mood swings, difficulty expressing their thoughts and feelings, and difficulty with forming and maintaining intimacy and connection. The person may appear cold and detached. Trauma can also cause a person to become needy, clingy, insecure, and codependent in relationships, especially if the traumatic event was related to abandonment or emotional abuse. Trauma can have a negative impact on one's thinking patterns, causing them to view themselves, others, and the world from a negative, pessimistic outlook. How is trauma triggered? Trauma can be triggered by any internal or external trigger that reminds the individual of the traumatic experience. Coping with trauma. To cope with trauma, many turn to negative coping mechanisms such as alcohol or drugs or high-risk behaviors. Although this may provide temporary relief or numbing, these coping skills do not last and never resolve the problem. In fact, these behaviors tend to create bigger problems and worsen the effects of trauma. So what is the best way to cope with trauma? Here are some helpful tips. The best way to cope with trauma is to identify the traumatic event and how it is affecting your life. Identify how you want to feel and function and state this in specific goals. Next, be prepared to face and work through your fears and anxieties. There are a number of evidence-based therapies to help individuals with this. Here are 12 coping tips to help. 1. Know your triggers. When do the anxious thoughts and feelings arise? 2. Practice mindfulness and grounding techniques. 3. Learn to challenge and change anxious thinking. 4. Learn and practice affirmations to replace anxious talk with affirming talk. 5. Make a decision and commitment to let go of anger, fear, and resentment. 6. Be open to forgiveness. Develop self-compassion. 7. Communicate your needs and expectations. Express your thoughts and feelings. 8. Cultivate an environment that feels emotionally and physically safe. 9. Establish healthy boundaries so that you preserve your time and energy and use it wisely. This will prevent you from being too distracted or overwhelmed. 10. Build a support system with trusted individuals, and this includes seeking professional help from your doctor or therapist if needed. 11th, engage in activities that help you feel calm and safe. 12. Prioritize your self-care through balanced meals, regular sleep, and movement. When your mind and body are calm and free of stress and pain, you have more balance, strength, and resiliency, which are protective factors to help you cope with anxiety and other stressors. Stay tuned for more videos.